Is your doctor's office the best place to measure your blood pressure? The answer is no.
Hello, my dear friends, colleagues. Hello, ladies and gentlemen.
Do you have high blood pressure? Or are you worried you may have a risk factor for it? So what happens at the doctor's office? Usually it happens like this. You're taken in by the nurse to a room, you're being asked questions, and your blood pressure is being taken by the one-size-fits-all BP cuff all at the same time. And that, my friends, is your blood pressure that the doctor will use to decide about your future health. But this is so far from ideal. If anyone ever had even a slightly different experience at the doctor's office, do let me know in the comments below. The proper standard method is that the patient is to be seated in a chair for 5 minutes before anything is done, with legs supported and arms supported, with short sleeves which are loose and not tight, not having smoked recently, and no talking for all those 5 minutes. Then have to ensure that the cuff fits correctly and it is not too loose or too tight. 2 readings are taken 2 minutes apart, and then you take an average, and that should be your blood pressure. Now, how often does this happen at the doctor's office given the crunch for time and space? But so it seems we have so many issues with BP testing at the doctor's office. So for your own health, what are your options and what should you do? Automated machines are actually not bad, but most people may not be doing it the right way. For example, measurement after a meal could not be accurate as blood flows into your gut and your BP measured would be lower than what it actually should be. Now, it is actually recommended by the United States Preventive Services Task Force and is routine practice in Britain for a person to measure every 30 minutes to 1 hour, ideally for 24 hours, but realistically speaking, it's done during the time you are awake. This is called ambulatory BP monitoring. This can be done every now and then or however frequent it is needed. Automated machines are actually fine for this and much more convenient. Just check the reviews before you purchase any machine. Not only will this give your accurate blood pressure, but it will also help your doctor optimize and decide how much and when should you be taking your pills. It is these values which should be used to manage your BP. Now we know, and let's record those readings. Now guys, the reason for these videos is basically for the public to know about their health. And it happens ever so often that the physician may not have enough time to go into details of your health issue. And when we do learn and understand, we act better and take better care of ourselves. And that's the basic idea. Knowledge with practice always leads to improvement. Anyways, click on the subscribe button to get the latest info on health-related topics. And do share your experiences and thoughts or any struggle for yourself or for your family. I would love to hear your story. And always keep in mind that your doctor's goal is to prevent you from taking any medication. But if you have to, you must take them properly. My friends, stay healthy and stay safe.
Studies indicate that a majority of medical emergencies happen due to a failure to take medications properly and on time. Now that is a problem. Lisa is fully aware of this. She downloads the free iMed Tracker mobile app, selects English as her language, clicks on the plus sign, and gets her list ready in no time. Keeps track of her daily schedule, gets reminders, and never misses a dose. And instantly shares her list when she goes to her doctor. Stay healthy, stay safe. iMed Tracker.